Covert narcissism and avoidant personality traits share some similarities, but they are distinct concepts. It's important to understand the differences between them. Covert narcissism. Covert narcissism refers to a subtype of narcissism where individuals exhibit many of the typical traits associated with narcissism, but these traits are not as outwardly visible. Covert narcissists tend to display more subtle and hidden forms of grandiosity, entitlement, and need for admiration. They might come across as shy, sensitive, or even self-deprecating, but underneath, they still have a strong desire for attention, validation, and control. Some characteristics of covert narcissism include 1. Insecurity. Covert narcissists often have deep-rooted insecurities and feelings of inadequacy, which they mask behind a facade of humility or self-sacrifice. 2. Victim mentality. They may adopt a victim mentality, portraying themselves as unfairly treated or misunderstood, while simultaneously seeking sympathy and attention. 3. Manipulation. Covert narcissists can be skilled manipulators, using their apparent vulnerability to guilt or manipulate others into giving them the attention and admiration they crave. 4. Control. Despite their subtle presentation, they still desire control over others and situations, often using passive-aggressive tactics to achieve their goals. Avoidant personality traits. Avoidant personality traits involve a pattern of social inhibition, hypersensitivity to negative evaluation, and feelings of inadequacy. Avoidant individuals often avoid social interactions due to their fear of rejection or criticism. Their traits might include 1. Social anxiety. Avoidant individuals experience anxiety and discomfort in social situations, which leads them to avoid them whenever possible. 2. Low self-esteem. Feelings of inadequacy and inferiority are common among avoidant individuals, leading to a lack of self-confidence. 3. Hypersensitivity to rejection. They are highly sensitive to perceived criticism or rejection, often interpreting neutral or ambiguous situations as negative. 4. Isolation. Avoidants may isolate themselves to prevent negative interactions and avoid the discomfort they associate with social situations. While covert narcissism and avoidant personality traits can coexist in some individuals, they are distinct. Covert narcissists seek attention and admiration in subtle ways while masking their grandiosity, whereas avoidant individuals are more focused on avoiding negative interactions due to their fear of rejection. As with any personality trait or pattern, understanding and self-awareness are key to addressing and managing their impact on one's life. If you're concerned about your own traits or the traits of someone you know, consider seeking guidance from a mental health professional. Deciding whether to go back to a relationship with an avoidant individual is a personal and complex choice. It's important to approach this decision with careful consideration and a clear understanding of the dynamics involved. Here are some factors to consider. 1. Communication. Honest and open communication is essential. If you're considering going back, talk with the avoidant person about the challenges you faced in the relationship and discuss how you both can work together to address them. 2. Self-reflection. Reflect on your own needs, boundaries, and emotional well-being. Consider whether the relationship aligns with your values and long-term goals. 3. Growth potential. Assess whether the avoidant individual is willing to work on their avoidant tendencies. Both individuals need to be committed to personal growth and addressing the challenges in the relationship. 4. Professional help. Consider seeking guidance from a mental health professional either individually or as a couple. A therapist can help you navigate your feelings, understand the dynamics, and provide tools for effective communication and managing avoidant behaviors. 5. Boundaries. Establish clear and healthy boundaries in the relationship. Make sure both individuals understand each other's needs and are willing to respect those boundaries. 6. Realistic expectations. Understand that avoidant tendencies might not completely disappear. Progress may be gradual, and setbacks can happen. It's important to have realistic expectations and be patient with the process. 7. Compatibility. Evaluate whether you and the avoidant person are compatible in terms of your emotional needs and communication styles. A relationship can thrive when both individuals support each other's growth. 8. Support system. Seek support from friends, family, or a support group. It's helpful to have people who can provide objective perspectives and advice as you navigate your decision. 9. Codependency. Examine whether there are codependent dynamics at play. Be mindful of your own emotional well-being and avoid returning to a relationship that might negatively impact you. 10. Personal happiness. Prioritize your own happiness and well-being. Consider whether going back to the relationship contributes positively to your overall quality of life. Remember that relationships are complex, and there's no one-size-fits-all answer. It's important to make decisions that align with your personal values, emotional needs, and long-term goals. If you're unsure about your decision, seeking guidance from a mental health professional can provide valuable insights and support.